welcome to another edition of Hypnosis Helps with me, Neil Myers, and my colleague Bill Miller, both hypnosis practitioners here in Connecticut. And today we're going to talk about a topic that that Bill has been nagging me to talk about for at least for probably about 3 months now. Is that right, Bill? At least 3 months.
At least, yeah.
And it's not because it's not important. In fact, actually, it's a very important topic. And I'm very glad that Bill kept nagging me because when Bill and I began preparing this and looking at the material again, we both realised what an important topic this is. And this topic is concerning the use of hypnosis for pre and post surgical working effects.
Right.
So just to clarify that, if you or a relative or a friend is about to have a procedure or has a medical procedure booked, a surgical procedure booked, then the question arises, how can hypnosis be helpful in that? Can it be helpful?
Right. Because one of the major misconceptions about it is that the only thing that you could do with hypnosis is relax the person if they're nervous about the surgery. And I even had a client say, "Oh, I don't need any help. I don't feel nervous."
Right.
And everything, and it goes so far beyond that.
Right. Right.
So if you want to start talking about
yes,
that.
and it's just as I'm going to almost give you the summary at the end, at the beginning, which is that if you are contemplating, or if you have to have, or a relative has to have a procedure, you really should seriously consider the use of hypnosis before and after, for the simple reason that it makes the procedure itself more effective for reasons which we're going to talk about in a moment, and it also makes recovery much more rapid. In fact, actually, I've said to Bill and I, we really do wish, if I could have a little magic hypnosis wand and wish something, it would be that for everybody who is about to have a procedure, even simple procedures, that what we are about to describe here was a part of it. That it just in the same way that if people have certain procedures, they're expected to go for physical therapy afterwards or certain training afterwards, and that's part of the whole deal. It's part of the healing process.
Right.
In the same way, if only people could incorporate this, then I'm certain that procedures would be more powerful, easier for the surgeons and the doctors. Recovery rates would be a lot quicker.
Right.
And it's so simple. So out there, we should be forced to do it.
Right, exactly. And the basic thing is, like you said, it is about getting the patient prepared for the surgery beforehand. We'll talk about each of these areas, right? And of course about the recovery. But we're going to talk about some interesting things about the surgery itself, and really how does hypnosis help during the surgery. But let's start with the pre-surgery.
So you established a marvelous list there, Bill, of things. So what's number one?
Well, you know what? Actually, as I look at my little outline here, let's kind of step back from that and talk about something that we know about in the hypnosis world and so forth, is that there's really three basic laws we go by and everything. For every emotion, there's actually a physical reaction that occurs to it. And for every physical reaction, there is a corresponding emotion that could happen.
Thought cause alignment is sometimes called, or emotion cause alignment.
Right, there you go. And on a very simple level, you could think, if you have an emotion, you might tense up if you're afraid.
Right.
If you tense up and somebody's going to give you an injection, they're trying to push through muscle, that it makes it harder.
Absolutely.
It makes it painful and all that.
Right.
So your emotions will affect your physical self, and therefore can affect the surgery and how easily it's done.
Yes.
So that's one. And then the next one we always know is what the mind expects to happen will be realized.
Yes.
And so
it tends to.
Tends to be, right.
And particularly, just to clarify that, because it doesn't mean, folks, that if you're have trepidations or are scared or nervous about something, it doesn't mean that procedures are not going to be successful because your mind has hijacked it. However, it comes back to what we've talked about before, the bypass of the critical faculty. Has that been accepted into the subconscious mind? And the chances of entering a hypnotic state, even when somebody's telling you about something, they're describing a procedure to you and you're listening like this, there's a good chance you'll enter a hypnotic state.
Because we know that, authority figures tend to put us in
Right.
hypnotic states just naturally.
Right.
It's not that they're a hypnotist trying to do it,
Right.
but you focus and you just, all of a sudden you're in a hypnotic state.
Right.
And I like it. That's exactly right. It tends to be realized. That's not the fact. But so if you're told, well, the recovery is going to be 6 months, well, your subconscious is hearing that and saying, okay,
right,
I need to take 6 months.
Yes.
And other things is like if you expect pain, okay, you're going to get pain.
Right.
The biggest thing we've talked about before that one of the biggest mistakes is when they go to give you an injection, they'll say it'll be just a pinch.
Right, or this will just hurt for a short time.
Right.
or something like you'll feel, but they're always describing it in terms of pain, and
right.
we understand why they're trying to do that. They're trying to do that because they're trying to be honest with you. They're
right.
trying to warn you. They're trying to prepare you, but it's somewhat misconceived in the way it's done.
Right, right. And so it actually causes the very thing that they're hoping to avoid, right? It causes, because your mind thinks, okay, there's pain coming. Okay, it can create pain.
So the biggest area which we probably should devote a show to this is pain-free childbirth. Several shows. And of course, childbirth these days has become very heavy medicalised, but what's the expectation? Women are told routinely, and have often been told since they were little children, this is the most painful thing you're ever going to experience in your whole life.
Right.
And so that message has been put about for a long time, and there are all sorts of things to reinforce that, from things that they're told about managing the pain to everybody seeing the Hollywood view of childbirth where somebody's screaming. And
right.
So I just watched a show recently, and it was I can't remember, Vikings or something like that, and somebody's giving birth, and of course they're screaming and shouting, and because that's the image. So they're basically saying, you see, even in Viking times it was just as bad, nothing's improved.
Right.
So the expectation is that very heavily reinforced over a long period of time.
Right, exactly. And so you've got, the thoughts or emotions create physical. You've got what the mind expects to happen tends to be realized. And then the last one is, imagination is more powerful than knowledge, whether it's your own mind or the minds of others. And so if you get it down in you that, this is going to be bad and this and that, even though you might intellectually, consciously know it won't, you'll be okay. If you're believing it down inside, it also has a tendency to affect it.
Yeah.
So and as we go through these, we'll see how these various things can affect the surgery and pre-surgery and so forth. So so there's a lot of, let's talk about the challenges. There's a lot of challenges that the patients face.
Yes.
Going into surgery. There's fear about the surgery. Maybe there's anger about having to have the surgery.
Yes, and this is one of these things that I like to, when I'm working with people, like to examine in advance, because sometimes the surgery may be as a result of an injury. Sometimes it may be as the result of somebody else doing something that caused an injury. It may be the result of them being in a situation that they shouldn't have been in, don't want to be in.
Right.
Or they just may feel that the gods are not with them, that fate has sometimes somehow caught up with them, or maybe even resentment against God. That can happen. Why is God? Why me? Why is God doing this to me? Why should I be? I've done the number of people I've had who've come with this, and in the conversation starts off, well, I've got to have this procedure and so on, but I don't understand. I lead a healthy life. I eat right. I do my exercise. In other words, it's unjust. It's unfair.
Right.
So the first thing I'm dealing with is actually the sense of injustice, the sense of unfairness, which produces a result.
Right.
And it's almost as if they feel as if somebody's getting revenge upon them for something which they don't know that they've done. So there's this emotional construct going on behind it, and it's not helpful, folks, physiologically.
Right.
And this is, something I really want to stress is that we're talking about a link between the body and the mind. These days, I'm not even sure there is much difference between the body and the mind. It's almost like the mind in the body and the body in the mind. We talk about them separately because that's the way the Enlightenment told us to talk about them. We separate one thing from another. But the mind, as we know from our model, the subconscious mind is governing the autonomic functions of the body. The intelligence is governing how the organism operates.
Right.
So when there's a strong emotional basis and then the body undergoes a procedure, it's not as if the body is just a machine, just a mechanism, just a slab of meat with neurons and electrons or nerve endings and muscles and tissue and bone. It's more than that. It's something living. There's an intelligence there.
Right.
And so emotions are an important part of the equation.
Right.
It's not just about feeling good about it.
No, because you're carrying those emotions into this surgery with you.
That's so well put, yes.
Yeah, and the other thing too is that you don't even think about is we're just talking about all these emotions over the surgery. There may be emotions you've been carrying over this condition that's leading to the surgery.
Another great point.
Again, resentment, maybe anger, like why is this happening to me?
Yeah.
And if it's something from birth, you may have been carrying this a very long time.
Absolutely. Yeah.
So very, very deep things that we may have to actually do some regression hypnosis to work on.
That's true. Or another thing related to that may be, let's say people are told they have, well, you know, I have, my father's unfortunately suffered from, I can't remember whether it was osteo or rheumatoid arthritis, but his hands were quite gnarled like this.
Probably rheumatoid then.
Probably, yeah. And by the time he was much younger than me, even 10 years, his hands were already like this and he had these large nodules on his knuckles.
Right.
And the message was sent out, I'm supposed to get this because I'm his son, you know. I'm going to
sent to you.
Yes.
Yeah.
You know, that he would show me, so almost indicating that, you know, I'm going to have to deal with this someday. So far, so good, folks. I mean, it doesn't have to be that way.
Right.
But there's this notion, if my, so for example, I worked with somebody and she was told because her mother had a propensity towards a condition that led to breast cancer.
Right.
That was going to happen to her as well. Even though there was no immediate medical evidence that anything like that was occurring or had occurred. And I remember this particular person, it wasn't even a confirmation of this condition, but she just believed and was told that there's a possibility that it might develop, and she elected to have a double mastectomy.
Right, based on that.
Based upon that, and there was no real, confirmation of anything at that point.
Right.
But she was so obsessed with the idea that if Mum had this, I'm going to get this. It's just a question of time, so I might as well do it now.
Right.
And then she went along and as she told me, she how did she put? Well, she bought herself some replacements. She put it a bit more prosaically. But clearly there were very, very, very strong emotions there.
Right.
And there was strong, and of course, even though she elected to have that procedure, she had it.
Right.
I'm sure there were strong emotions at that time as well. So
yeah, because even if you're picking that procedure,
right,
especially afterwards, you may have regret for it and say, well, maybe I should have done something different, and this and that. And so there's a lot to it. We're actually going to touch on a couple other things along those lines of feeling that this is my destiny and things like that. But let's back up to the emotions and too.
Right.
And I'm sure as everybody knows, one of the biggest ones is the emotion of fear.
Right.
Right. And so, well, what's the sources of the fear? Well, you're going to go in for a surgery. Your family and friends are going to say, "Oh, I know so-and-so had this, and it went all wrong and everything."
Right. Oh, my friend almost died on the table.
Right.
Or they were never the same, and you've got the. But I'm sure yours is going to be okay.
Exactly.
Right.
And then people nowadays, the modern thing is you're going to Google your condition.
Right.
And your surgery.
Right.
And you're going to go, "Oh my goodness." I will say that I must be the real exception to this because I blew a disc out a few years ago and they had to go in and do a discectomy and take it out, and they have to cut you open right down to so you can see the spinal cord. And of course, as a scientist, I watched a video on this surgery that we were doing on somebody else before, and I went, "Oh, that doesn't look too hard." So for me, it had the exact opposite effect.
Yeah.
And I went, "All right, this should go."
Well, sometimes, the other thing, of course, apart from just being able to Google anything you can about the surgery itself,
right,
the statistics, the success rates, the failure rates, these days you can actually probably find a video where you can actually watch the surgery.
Well, that's what this was. Yeah.
And some of the surgeries, I mean, if you look at a hip replacement, they can be pretty brutal. Yes, people hammering along there.
Right.
And so,
right.
All of these things can feed into the idea of you see a frail elderly person watches a hip replacement where she sees the surgeon, being very, very aggressive as part of what they have to do sometimes,
right,
but not understanding necessarily the context of what's there, thinking, what's that going to do to me?
Right.
You know, how am I? And immediately there's a strong emotional response.
Right. Exactly. And then it goes back to the, you know, you're expecting it to be really bad. So it tends to, to be realized.
Even a simple thing like, you know, observing that and seeing that, or reading that you have to bank a certain quantity of blood,
right,
or that you may even see a lot of blood if you're able to, you know, find a video of the procedure on YouTube or something.
Right.
So yes, all these feed in.
Yeah, and then, you know, so your family and friends Googling it and so forth. And then, of course, the last one is the doctors and nurses themselves when they tell you everything that could go wrong because they have to, because of legal liability.
Right.
And a lot of times you might be thinking in the background, okay, that's going to be me. You know, this can go bad. Oh, that's what's going to happen to me. And so you start kind of believing it inside, and that's really not a good thing to be doing. And the types of fears. It can be fears of losing control. It can be fears of the anesthesia. Will I wake up from it? You know, it can be fears of will I be the same after the surgery? Will I be scarred?
Right.
Will it change my life in a negative way?
Right.
You know, and all those kind of things. In the case sometimes of, say, they're going in after a tumor, you might worry that are they going to find it's more extensive than they think it is, and all that. So there's really a lot of fear that can be there. And one of the things I will say is, even if you feel like you're going in and you're saying, I feel pretty good about this, it's still good to do hypnosis because you never know. I know I went in for a routine colonoscopy years ago, and I'd had one before. I felt calm for it, and I'm on the table, and they took my blood pressure, and it was 160 over 110, and I went, well, consciously I was calm, but obviously I was stressed underneath. You know, the subconscious was worrying about it. So I think that even if you feel relatively relaxed, it's good to do the hypnosis program. Plus, it does so many other things. You know what I mean, and things like that. So, you know, and you talk about. So you've got all this fear. Well, what are the effects? Could cause you to do some poor decision making. You mentioned a woman saying, I want a double mastectomy. Well, maybe that's a good decision. We won't second guess that particular one, but maybe other ones wouldn't be. And maybe you elect to have something more radical when you could go lesser and things like that. So it really can affect, you know, all those, your judgment, and also it tenses you up. It tightens up your systems. Things don't work as well. That's why my blood pressure was going up. Your heart rate may go up. So it has a lot of effects on the physical body, all that emotion.
So one of the things that was, and I've mentioned this on the show before, but this is the perfect time to mention it again. A friend of mine had to have a rather extensive procedure on his eyes. And this is a procedure where they can't give full general anaesthesia. There has to be local anaesthesia because they have to be able to refocus their eyes, change position of their eyes, and give feedback to the surgeon. And this surgery can last as little as 45 minutes, but it can last it can last a lot longer, an hour, 2 hours. In my friend's case, the poor chap, it was 9 hours. His was a very exceptional and difficult case. The interesting thing is the surgeon had somebody who was due to have the surgery shortly after, who could not use chemical anaesthesia of any type because of allergic reactions. And I was not the hypnosis practitioner, but they brought in a hypnosis practitioner whoever that person was, you did a good job, because that person was able to go through this procedure, which in their case I think was about an hour and a half or 2 hours. And my friend asked about it the next time he saw the surgeon with a follow-up. Obviously, the surgeon couldn't give him the specific details of the patient, but he was very, very excited. He said, and by the way, this particular surgeon is a world-renowned specialist. He said he felt that was probably the best he'd ever done because of the condition of the patient was so good. And the fact that they didn't have any anaesthesia meant that he could very, very finely tune and get very, very good feedback from his patient. And he said, I wish everybody could have the procedure done in that way. It was so much more effective. The surgery was so better. And that's the irony. Everybody can. That's true.
And really, you know, I mean, I just want to reiterate that because I'm sure people in the audience will say, what do you mean no anesthesia?
No, she couldn't have it.
The fact is that you can actually, and then back in the 1850s, before there was chemical anesthesia at all, they had to do some certain surgeries, and we've talked about that in a previous show with Dr. in India.
The Esdale.
Esdale, that's right. And they would do them just under hypnosis, and people weren't feeling pain.
Exactly. Now, and again, coming back to something we said then, again, we talked about anaesthesia before, and we're not going to go over that ground again, but it is related here. But here's something else. We know that same surgery, now this patient couldn't have any anaesthesia, but let's talk about all the other patients that can.
Right.
How about what the surgeon is saying in a way is less anaesthesia, better for the procedure. Well, we know with our procedures we can cut that down maybe by 75%.
Right.
So even if we use chemical anaesthesia in conjunction with hypnotic anaesthesia, you get better results, which is exactly what the Mayo brothers discovered all those years ago, and how they were able to positively affect people's lives by using the combination of the two. And so again, we're talking here about hypnosis as a complement to procedures, not as a replacement to procedures. Too often, one of the things that distresses me is that very often when one talks about complementary or alternative therapies, it's an either-or discussion. But in the case of hypnosis, what we're talking about using its power, the power of the subconscious mind, with a procedure. Look, if you know my young son, he unfortunately cut the back of his knuckle here on his left hand, and it was a very deep cut, and he put a nick in the tendon, so we had to go along to a hand specialist. But here's the thing. He wasn't at all stressed over the stitches or the removal of the stitches or anything about the procedure, nothing at all. He needed to have that procedure.
Right.
But the procedure could be made a lot easier, a lot better, a lot more comfortable, a lot more successful with what we do.
Right.
And what we do is using your subconscious mind.
Right.
You know, that's what we're talking about.
And really, I remember years ago I had a supervisor, and actually he had to go in for major heart surgery. And at the time, and maybe it's different now, but at the time, he was told that a lot of the negative effects that he could experience after the surgery was because of the level of anesthesia. And so if you could reduce it, even a reasonable amount, that means you'd have a better recovery. You wouldn't have as many of these issues to deal with after surgery.
Right.
You know what I mean? So there's just a lot on that, that all this can, the fear, the emotions, and this and that can affect it. And besides the fear and emotions, if you can even use it to cut down the anesthesia and so forth safely, then it can affect the outcome and the recoveries.
So one of our colleagues who does some of this work is a surgeon, and he once said to us in a recent meeting, "Well, what surgery?" And it's a controlled stabbing. It's a controlled, and so when that occurs, something at a very, very deep level occurs in the system, because the system is being assaulted in a surgical procedure. Now, of course, it's not the intention of the surgeon to harm the person, and of course the person knows that consciously before the surgery, but the effect is to the subconscious mind is it feels it's under assault, and so protective mechanisms come up naturally, which may not be helpful for the procedure.
So let's talk, that's a nice segue into it. Let's talk about that too, because now you've got we're past the pre-surgery as far as things, and we can cycle back, but we're in the surgery. One of the things that most people don't realize, and doctors don't realize, is that even if you're under total general anesthesia, your subconscious mind still knows what's going on.
Absolutely, and this, I think, the first time this was recorded convincingly was with the hypnotist Dave Ellman, who we mentioned many times on the show, one of the greats, and the discovery simply happened like this. What do you remember the actual procedure? Was it?
It was a gallbladder removal, is what it was.
Thank you. It was a gallbladder removal, and this lady had had a gallbladder removed, and she was experiencing pain and other symptoms, but there was no
physical reason for it to have
pathology, nothing they could find at all, and completely mysterious. And so in hypnosis, Dave Elman regressed her, and she got back to the actual surgery.
Right.
And she heard the conversation. The one surgeon who'd looked at the gallbladder and said, "Look at this. This woman will never be the same again."
Right.
And she interpreted that to mean that she would never be a well person again.
Right.
And of course, what he meant was the exact opposite, was that she'd never be troubled by this again.
Right.
And so once that basic misunderstanding was corrected, all the pains and all the symptomology vanished instantly. But the interesting thing, and the thing that nobody believed to that point, was that she was able to report the conversation between the surgeons, even though she was under a state of general anaesthesia,
right.
chemical general anaesthesia, not hypnotic. And of course, that had to be confirmed with the surgeons themselves, who confirmed that that was exactly the conversation that took place.
Right.
Specific. And so if anybody tells you that you can't hear or you don't know what's going on under general anaesthesia, we've known, and at least since the 1940s,
yep.
and possibly earlier than that, that you can hear conversations. Your subconscious mind is never truly asleep. It's always there to protect you. Sometimes the example I give is, I ask people, you don't roll out of bed every night because your subconscious is still aware of the location of the end of the bed or where you are, the room, smell of smoke or something burning. You're probably going to wake up straight away,
right.
unless you're drunk or under the influence of drugs or something.
Right.
And so the subconscious is there, and the subconscious was right there in that surgery. But you're also completely open to suggestion. You are in a hypnotic state. There is bypass of the critical faculty. That's one of the reasons why, I hear that it's quite fashionable these days in surgery to have music playing. And depending upon what the fashion of the music is, if it's a peaceful, serene, harmonic piece of music, that's one thing. I'm not quite sure what the effect on the subconscious mind would be if there's hip hop or rap going on with some of the lyrics there, and in a hypnotic state, those entering the mind, if that's the particular thing that the surgeon wants to have playing because it relaxes him or her.
Right.
I'm not sure I would want to have that
right.
playing
right.
in the background.
Right, exactly. So. And it really, this whole thing goes back, especially with your example there, is that to one of the rules that I was talking about at the beginning, is imagination is more powerful than
right.
knowledge, right? Well, when we're talking imagination, we're basically talking the subconscious mind.
Absolutely.
And since the subconscious mind is always on, it really couldn't be turned off, or else you'd be dead.
Right.
Since it controls blood pressure and heart rate and all that kind of stuff. So that imagination is still active.
Yes.
And so it says, oh, okay, I'm not going to ever be the same.
Right.
I'll make it so.
Right.
And so that's the real thing. And doctors can inadvertently say an awful lot of things.
Yeah. One of my favourite ones is the nurse thing, where people get coming up perhaps from anaesthesia and say, "Don't worry, it'll all be over soon," or it's all over now. Words like that. It's all over. That could be interpreted in many ways by the subconscious mind. Instead, they could, as people came out, they could actually give immediately suggestions for health. As you come up, you're going to feel great. You're going to recover. You're going to recover quickly. Your health is going to blossom and bloom in a way that it greater than it ever has before. You're going to feel so good as you come out from this, and everybody is here to help you, work with you, be with you. Nurses could simply be trained to say things as simple as that, and be conscious of what they're saying, even a script.
Right. And the funny part about this is it sounds like we're just talking about happy talk and things like this, but really what we're talking to is not even the conscious mind. We're talking to the subconscious mind.
No,
and I know that, I can't remember what the reference was, but there was doctors referencing something I was watching or reading lately. The doctors, emergency room doctors, have found that, if you go up, if somebody's in bad shape, they've been brought in from an accident, there's a big difference in their survival, between going up and saying, "Oh boy, this guy doesn't look